Today we're going to be going over an emergency response plan with the topic being severe bleeding caused by laceration. Let's set the scene. On a bright Sunday morning, 24-year-old Marcus decides to go out with his family to enjoy a day at the park, playing football and having a picnic. The football game begins to get very intense and competitive. As Marcus goes to catch the ball and run the winning touchdown, he overestimates his jump and falls on his side. Unbeknownst to him, a few minutes before, a broken glass bottle was thrown into the play area, and this is what Marcus falls on. A sharp shot of the glass slices deeply into his left forearm, causing severe bleeding. As a bystander, it is important to act quickly in assisting Marcus with his injuries. Some signs and symptoms that Marcus may begin to display as time goes on are as following: heavy bleeding, blood pumping from the wound, bruising around the affected area, the inability to control bleeding with just simple pressure, confusion and decreased alertness, clammy skin, dizziness or lightheadedness following the injury, paleness, rapid pulse, weakness, and shortness of breath. According to American Red Cross, this is the order of steps you should follow when aiding Marcus. First, you should begin assessing the scene. Make sure it is safe to assist Marcus with his injuries. Form initial impressions of the scene and of Marcus. Ensure you have verbal consent before aiding Marcus, especially if he's still conscious. Apply PPE, such as disposable gloves, before aiding Marcus. Check for signs and symptoms. Is the blood equal or more than half of a soda can? This will signal to you that his blood loss has become life-threatening. Is blood spurting or flowing continuously? Is Marcus displaying symptoms of shock? After checking for signs and symptoms, you want to be sure to call 911. When calling emergency services, you want to make sure that you give authorized personnel the best and most efficient opportunity to give Marcus further aid. You should state the location and address if available. If you do not have the location and address, make sure you use landmarkers nearby to assist you in your location. Be sure to tell the emergency responder what kind of assistance is needed. You could say, I have a 24-year-old here who has just received lacerations, who is experiencing severe bleeding caused by lacerations. Give clear answers to the dispatcher about the victim. Follow all directions given to you. If they ask questions, answer them to the best of your ability. Remain on the line until EMS arrives or until you are told it is safe to hang up. Following these steps will ensure you give Marcus the best opportunity to receiving the help he needs. Now, when aiding Marcus, you want to make sure you understand the risks involved. For Marcus, if he continues to experience blood loss at a high rate, he can go into shock. He also has the possibility of infection. With an open wound in the playground, he could possibly come in contact with dirt in the wound and it'll become infected. He could also worsen the injury, depending on how he is reacting. If he is flailing and moving around, it could what is the word? It could decrease your ability to help him. For me, the person who is giving Marcus the aid, I could be exposing myself to bloodborne pathogens. This is why PPE is so important. I can also come in contact with the risk of infection. If I have an open wound or a cut and I am helping him in the scene, I could hurt myself. And I have the possibility of an unsafe environment. This is why it's so important to stay alert and conscious when helping. After you have called 911, you are able to give him care until they arrive. You want to begin by applying direct pressure to the wound and utilizing a tourniquet if the bleeding is life-threatening. If you do not have access to a tourniquet, you want to use wound packing to aid severe bleeding. You want to continue checking on Marcus, monitoring his breathing, and you want to prepare to care for shock if symptoms are displayed. Make sure you stay with him until EMS arrives. Do not remove embedded glass. Position him appropriately and continue to reassure him that help is on the way. Watch for changes in his condition, such as breathing or if the skin becomes pale or bluish. Here are a couple of visual aids, how to apply pressure. You want to apply direct pressure up to external wounds using a sterile cloth or your hand, maintaining pressure until the bleeding stops. When using a tourniquet, you want to pay attention to where you are applying the tourniquet. You want to apply it inches above the wound. And you want to make sure you are not applying the wound. You want to make sure you're not applying the tourniquet on a joint. This could stop blood circulation to the area altogether, and that's not what we're looking for. Here we have signs of shock. There may be an altered mental state. Inconsistent breathing, arterial hypertension, elevated lactic acid levels, skin could be sweating or blue or pale, and he could be not able to pee. Responding quickly can mean the difference between life or death. As a bystander, it is important to make sure you are not just watching things happen. If there is no one else available to aid in a situation, you should be able to use all knowledge learned and apply it to real-life scenarios. Doing so raises awareness. Most people do not realize how much blood loss is considered life-threatening. This is why acting in minutes is so primary. Uncontrolled bleeding can lead to hyperthermia, shock, and even death. This emergency response plan teaches basic first aid skills. These slides offer basic step-by-step instructions that are memorable and easy to act on. It also lets people know what not to do, such as removing embedded objects, approaching an unsafe scene, as well as proceeding without consent. It also promotes calm thinking and planning and encourages individuals to get first aid and CPR certifications. And here are my references.